Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org.
We are facing the most serious threat to public media in history. Right now, the White House is trying to rescind already approved funding for the Corporation for Public Broadcasting, money that keeps stations like ours running. Without it, essential local journalism, trusted reporting, and podcasts like this are all at risk. If you value public media, speak up now. Visit boisestatepublicradio.org/funding to learn more and take action.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. As Idaho's population continues to grow, so does the demand on our hospitals and the space inside of them, which is why a new program is stepping out of the clinic and into the homes of its patients. Launched late last year, the Hospital at Home program offers an alternative to the traditional hospital stay. It's giving people the option to heal in the space they feel most comfortable. So joining us now to talk more about this innovative program are Dr. Adam Ballinger, the medical director of Hospital at Home, and Mackenzie Teagues, a paramedic with St. Luke's, who helps provide care for the program's patients. I want to welcome both of you to the program.
Thank you so much. Great to be here.
Dr. Ballinger, it's nice to have both of you here. So Dr. Ballinger, let me start with you. Why did you decide to launch this program?
Yeah, great question. It started probably about 5-6 years ago. I was in a stuffy little conference room at a continuing medical education conference, and two of the grandfathers of Hospital at Home in the United States, out of Johns Hopkins and Mount Sinai, were giving a talk about it. And one of the things that really has allowed Hospital at Home to build was the advent of telehealth. And at that time, St. Luke's had a pretty robust telehealth presence, and it just made sense.
So, Dr. Ballinger, how has the increase in demand for healthcare services impacted, hospitals in the last few years, in particular your hospital?
Great question. Idaho has been, I think, the second fastest state for a decade. And while it's easy to move people, it's difficult to move, hospital buildings. And so what we've seen is essentially a really an increase in the demand for beds. It's also an outsized percentage of the folks moving to Idaho are over the age of 65, those that are in need of healthcare. And so, that combination has really created a really good use for a program like Hospital at Home, where we can move beyond the walls of a traditional hospital to provide care where patients want it in their homes.
So, Dr. Ballinger, how does Hospital at Home differ from home health care?
Great question. It's one of the things it's probably the most common thing that I'm trying to answer, because nobody has ever really seen a Hospital at Home program. In Idaho, for example, we're the first program of its kind. Home health essentially provides for chronic medical illness, or if you're recovering, say that you get an infection or pneumonia. It is after you've been treated. It is after you've essentially stabilized, and you go home, and typically you're seen a couple times a week. Keeping a closer eye on you than necessarily could happen in a doctor's office, getting some physical therapy. But it doesn't really. It lacks the ability to provide intensive care like you get in the hospital. And so what we're doing essentially is mirroring the intensity of care that you can receive in a hospital on a medical floor.
So, Mackenzie, let me bring you to the conversation because you go to people's homes. What are you checking for when you visit a patient at home?
Yeah, so each one of our visits, the patients get 2 visits, a minimum of the day. And typically we're going in, we're doing our vital signs, we're listening to the lungs, we're really asking the patients what their symptoms are, giving their medications. We may be giving them the antibiotics that Dr. Ballinger has ordered for them. And so that's where the care for us is really going in there and being the hands, the feet, the eyes for our doctors and for our nurses, being able to administer these things. a lot of things that we do as paramedics, right? We assess, we educate, we treat these patients, and that's what we're doing in these homes.
So, Mackenzie, what happens if there's an emergency in a situation like this?
Yeah, so we educate our patients and the family very well of how they can contact our virtual care team. So the nurses and the doctor, they do have a help button that goes directly into the nurses to say that there is something critical happening. It is at that point that we will determine, do we as the paramedics need to come out? Are they stable enough that we can come out to the home? Or that may be something that we need to initiate 911 and get the paramedics involved with something critical and bring them back to brick and mortar.
So, Mackenzie, how quickly can you respond if there is a serious issue?
That's a great question and very hard to, kind of answer for you because we have a large geographical area that we're covering. So each one of us as providers may be in Boise, maybe in Middleton, and clear out in Kuna. So we really draw from who is the closest paramedic to that home. That could be a 30-minute drive for us. And so that's where we bring in the kind of triage of, is it best for the patient that we do initiate 911 and get them the care that they need? Or is it something that we are able to get to? We do have a standard of about 30-minute response time to these patients' homes. But like I said, geographically, traffic that we're going through, it depends upon what time of day that we're traveling to their homes, that all comes into factor.
So, Dr. Ballinger, are there certain types of patients with certain types of issues that can only access this service?
Oh, great question. So the essentially what the service provides is, say you have a patient who's in the emergency department with infection, with heart issues, there's with chronic obstructive pulmonary disease, so kind of like asthma.
Mm-hmm.
Those patients typically would get admitted to a medical floor. So in the hospital, we have different levels of care based on how sick and unstable the patient is. A medical floor is going to be the most stable patient. So that's really because if we're taking a patient home, we need to have relatively high confidence that they're stable. We have very good processes in place to return patients to the hospital, but patient safety is number one.
Mm-hmm.
And so essentially, this would be things like patients that need IV antibiotics for an infection, patients that need IV diuretics and close monitoring for fluid retention relating to patients that have heart issues, patients that need inhaled medications because they're having a flare of a respiratory condition, and essentially patients that would be admitted to a medical floor and have either are independent with their mobility or have support at home to help them with their mobility if it's required. That's the patient population that we can take care of.
Mm-hmm. So, Mackenzie, are you able to build stronger, maybe working relationships with patients through a program like this? Because, I mean, you're going into their home twice a day.
Yeah, yeah. And most of the times we really do build great relationships with these patients because we're also wanting to help alleviate them going back into the hospital. So we really take the time to not only be able to educate them, but build that rapport of what can they watch out for? When should they be calling 911? And sometimes our typical assessment times is about an hour. That lets us be able to do what we need to do. In that time, there's a lot of dialogue that we learn about them. We learn about their homes. We learn about, who they are as human beings, far beyond just what they're in the hospital for. And you can see that within our teams where we can come back and we do talk about our patients and the fact of there are community members also. We're going out into their homes to be able to pass along information of how we can take out fall risk. We're talking to them about how we can better educate them on their pill processes and medication administrations. So these rapports with these patients, most of the times our patients, when we discharge them, they say, no hard feelings. We don't want to see you again, but we hope you see us out in the community. So I think that's a great explanation of how we're able to build that rapport. They don't technically want to see us again in the hospital, but they absolutely want to see us back out in the community with them.
So, Dr. Ballinger, how is the program funded? I mean, does insurance help cover this like they would for
Oh,
potentially like a hospital stay?
and that's honestly what has led to why this is new in the United States. So hospital home has actually been around since the 1960s in countries with universal health care, with single payer.
Mm.
And what started really the ability to have hospital at home programs beyond university settings is insurance. So as part of the pandemic, because of a shortage of hospital beds, there was approval essentially to allow for billing for a hospital care in a patient's home. And so at this point, we're now having some good conversations with our payers in the community about expanding this further beyond patients that are currently covered by Medicare.
Mm. So, it's only right now patients that are covered by Medicare. Did I understand that correctly?
Exactly.
Okay. I asked that question because I think back to in March, I had to have an emergency appendectomy. And granted, it was late at night and all of this. And so I had to stay overnight in the hospital. But I'm listening to you talk about this. And I was like, sure would have been nicer just to be able to go home and have somebody check in the next day instead of having to wait to get checked out of the hospital. But I am a private pay insurance person. So I would, right now, not qualify for a program like this.
Right, right. At this point, that's we're in conversations with our payers to expand access. In general, that's the type of case that you're describing is a common use of hospital home. Say a patient who has an infection that doesn't require surgery and needs IV antibiotics and close daily monitoring from a physician or PA or nurse practitioner. That's a patient that's great for hospital at home. Even patients after an operation, say a patient who had surgery but then is waiting for a return of their bowel function or needing some assistance with nutrition or needing close monitoring. It's nice to get to recuperate at home.
We know that in recent years, a lot of hospitals, and this is across the country, have been dealing with strains on staffing and capacity. I mean, to the point where sometimes patients are in hallways, right, waiting for a room. I- Does a program like this help to address and potentially improve these issues?
That is a great question, and honestly, that's the impetus for why St. Luke's is has invested in a hospital home program. There's something like, called the quadruple aim in healthcare, and it's basically where we're looking for a project that improves health outcomes at a lower cost, potentially, or neutral, improves experience of staff and improved patient experience. And hospital home is one of those things. The idea that hospitals are important places. St. Luke's
Hmm.
is our hospitals. I'm very proud to get to work in them. And as a patient, if I have a condition where I could get the quality of St. Luke's hospital care in my own home, it's nice to sleep in my own bed. It's nice to be able to be with my pets. And if that also allows for opening up capacity within our brick and mortar for those sicker patients that need to be in a brick and mortar, to be away from family, that's really where hospital at home shines.
Mackenzie, what kind of difference have you seen in patients who go through this program versus patients in a hospital setting?
Yeah, I think the patients that go through this program really get a sense of one, why we're doing it as well, right? They can see the overcrowding of our hospitals. They can also feel like they're making a difference in their community and helping out the hospital. So them being at home, they really get a sense also of their own healthcare. And so we have them very involved. And so they're getting to be more of an advocate for themselves. We're training them to be more of an advocate for themselves, to be asking these questions, to taking charge of their own health. And what you can really see with these patients is their anxiety goes away. You walk into the hospital room and they're so excited to be able to go home. They want to see their pets. They want to be able to be with their loved ones. And so they're excited. They're really excited to be able to still be, obviously getting the care that they need, but in their own environment. When we take them home, you can just see them excited. Their pets, start come running to them, and their caregivers, whether it be a spouse or a family member, really want to be able to help them out, and they want to learn from us as well. And so it's really, I come back to that education piece, not only for our community, but healthcare, all around that. And, they're so thrilled to be able to be in this program. They're thrilled to be, kind of one of the pioneering patients for us, and they're very real with us. We see them on their, kind of most vulnerable times in their most vulnerable places, and so they open up to us, and they feel safe, and they feel heard, and they feel taken care of, and that's what we want.
Well, I want to thank both of you for taking time to talk to us about this program. We've been speaking with Dr. Adam Ballinger, the medical director of the Hospital at Home program, and Mackenzie Teagues, a paramedic with St. Luke's. We've been discussing a new program that's giving patients hospital-level care from the comfort of their own homes. You've been listening to Idaho Matters from Boise State Public Radio. I'm Gemma Gaudet.
Planet Money helps you understand the economy. We find the people at the center of the story.
Garbage in New York, that was like a controlled substance.
We show you how money influences everything.
Tell me what you like by telling me how you spend your money.
And we dig until we get answers.
I had a bad feeling you were going to bring that up.
Planet Money finds out. All you have to do is listen. The Planet Money Podcast from NPR.